Hi, I'm Andrew Wallace. Welcome to the We've Got a Problem podcast, where each week we explore inspiring stories of struggle, success, and solutions to prevalent problems and how our guests have turned a problem into an opportunity. Today, I'm joined by Joan Landino and Jane Buckley, two former mental health care providers who just happen to be identical twin sisters. Known as the Therapy Twins, they're on a mission to break the stigma of mental illness and help people to love more and fear less. Joan, Jane, welcome to the show.
Thank you so much. We're so glad to be here.
It's
Thanks.
great to have you. So let's start with some background. Where did you start? How did you get here? You can skip the whole God created the world and all that, and we'll just skip to your lives. How did you get here?
We got here, I think it was a thing called a stork, but we got here in the 60s.
Yeah, right.
And we weren't supposed to make it. It was pretty well known that you got to hurry up, name them, baptize them. Let's give them their last rites because they're not going to make it. Oh. And, it got a little better from there, a little worse from there. And then we went into the mental health field. And I'd like to just admit for myself, of course, I went in it to self-diagnose. I wanted to know what was wrong with me. I wasn't sure what was wrong with me. I remember being in college
wondering what was wrong.
I had myself convinced I had a particular leukemia and I was going to therefore die because I was going to just get every illness, etc. But anyway, so then I get my diagnosis and I'm trying to follow Western medicine and get therapy and meds, and some worked, some didn't. And then, Joan's doing it too, and I notice she's laughing a lot more than I am, and I'm wondering, what the heck am I doing wrong? And really, when it comes down to it, you can't take life that seriously. It wasn't until my son said, you can't take a joke, that I was going to prove him wrong. And who do I get that? I had to go follow Joan, who's like a natural born comedian.
And I'm just the younger twin who followed the older twin in everything except for sex.
All the boring things. You see that? She followed me in the boring things.
Well, I didn't have to learn anything with sex. I didn't have to know how to go for an interview or whatever. But anyway, the best part of our careers ended up being is the last year we started doing it together. And what happened was pretty much we had everyone laughing. People wanted more of a group setting because they would hear the laughing from the other office. When we started doing it as the twins, people just wanted the double input, same DNA, different perspective. That's where they wanted to go. See, everyone was right in that setting, right? They were so happy.
Right. Hey, that's really, really important to find something special and different. And I think part of the issue is, or part of the cool thing about it is the difference. It's not something you get normally to get double input, double perspective, same DNA. I mean, there's been a lot of stuff going around. There's a lot of stuff in the literature about trauma. And I know that you both have kind of focused a little bit on that, calling it the tiger biting our heels, things like that. How many people are affected by trauma? Is it that common?
Wait, besides 100%, because we don't all have to end up with PTSD. Right. It doesn't have to be a diagnosable thing, but I don't think you escape this human life without a little bit of trauma.
Yeah, nobody gets out of this unscathed.
Yeah. There you go.
And the key is back in the early 80s in psychiatry, we were doing the correct thing. Who would have known? We got written up so many times, for doing the wrong thing. But who would have guessed? Who would have guessed that all that, it was called occupational therapy, but it was in psychiatry. And even as a new nurse, I was in Vermont skiing with patients. I did not go on the camping trip. I was not an outdoor girl at the time at all. Well, the ski lodge, you'll probably say why, but I was in the lodge. And then we went out for pizza and all those things. So what we did was we allowed them to become human again, but they regressed first. Nowadays, it's in and out. Back then, it was average length of stay, they said, was 10 months, but people stayed for 3 or more years.
In certain, there was actually such a thing as long-term psych. That
yes.
You don't hear of that anymore.
The unfortunate part was back then the medicines were more toxic, but we learned how to teach patients more, and it was called medication vacations. and they would go off the meds when they were doing really, really, really well. And then they would note their symptoms to come back. And I don't recall if that was yearly or whatever, to avoid some severe side effects.
Mm-hmm. Right.
But nowadays, everything's kind of turned into a 5 or 10 day stay. Everyone gets a certain amount of meds that are on the hospital formulary list. And everybody gets kind of pushed out quickly, and everything goes to the outpatient treaters. And a colleague of ours said, yeah, we discharged her back to the problem.
Right.
Right. Yeah.
That's kind of what our society does now.
We released a bunch of people back to society, right? In some cases, that is the right thing to do. When you go, okay, stable, whatever, I'm sure, fine, right? We can't make any diagnosis on anybody or prescribe one path for everybody, which is probably the mistake of giving everybody the same 5-day thing and then, okay, get out of here. But the crisis that I know we had here in California was we let a lot of people who probably needed to be in more of a setting that was more conducive to ongoing treatment, and force them out because we didn't have anywhere to put them. And it's the same issue that we're having currently or had for a while with homelessness here in California, where I think the ACLU actually sued because we were locally arresting homeless people for vagrancy when we didn't have anywhere where to put them. There was no. And just because you don't have a place to put them doesn't mean you can just make it illegal and take people and do something with that. And that becomes problematic. So when you go, well, I don't have anywhere to put you, that doesn't mean that's the right thing to do for that person, right? Just because I don't know what to do with you doesn't mean that not doing anything is the right way to go about it.
Oh,
for
how
sure.
awful it is. We lived through the
Release of everyone.
The release of everyone from the long-term facilities.
Mm-hmm.
And what's that thing, 6 or 7 degrees of separation? Our older sister knew the mother of the little girl that got stabbed by somebody that gets let out, has nowhere to live, obviously gets off their medication. And then that goes to the newspapers, and then people think all mentally ill people are violent, because we are just a very reactive society, or a black and white society. And I don't mean races, but
no, like black and white thinking, right? I mean, that it's one or the other, that there's no shade of gray.
Yes. Yeah.
Yes. Yeah. Yeah. And of course, so few of us develop any kind of experience that would give us the ability to see firsthand that there are, in a sense, shades of gray. You get 2 experiences, you're like, okay, good, bad, done. And that's, label it all. And there's one thing. Right. And we like to put judgments on these things, right?
Not only judgments, we have to sentence people. And often it's to death for very, very tiny little mistakes. And we've got to sentence them for the rest of their life now.
Right.
God forbid you learn from a mistake. God forbid.
Or be rehabilitated, right? Heaven forbid you like, that was a mistake. I know it was a mistake. I won't be doing that again. Ever.
Like the time I went right on red. The one time I go right on red, the cops were right there. Jesus Christ.
Well, we can go right on red here in California. I don't know about you.
You get to do it now.
Oh yeah, now. Most states, I think you can.
Yeah, not New York. Still, somebody said that was the only advantage to living in California. Moving from New York City to LA was that you could turn right on red. He's like, otherwise,
New York's tough.
Yeah, absolutely. So, I mean, let's talk just a little bit more about trauma. You say everyone is affected by trauma. So why is trauma biting our heels? Why is it such a problem? Why can't we just? I mean, this is I'm asking absurdly loaded questions here, but why can't we just?
I love that question. Oh, I love it. She somewhere my brain went somewhere. So let's say I always talk about animals because that's how I learn. So I call it the zebra effect. That herd of zebra, they're all going to be targeted by the lion or whatever's going to attack them. Somebody's going to get hit, but if they don't die, I mean, even killing it, that rest of the herd is now traumatized. But they go back to a community. So say one of them lives, take that person, because that's really bad now, that one who got attacked but is alive. take that zebra and allow for regression. They coddle that zebra. What do we do to, like, say a substance abuse relapse? Oh my God. We actually, what did we do in East Hartford? I think it was East Hartford. Could have been Hartford. Let's just call it that. In a detox facility. It was more of a rehab though. And a woman in a wheelchair relapsed and her urine was dirty. And we happened to have a nor'easter that was going to be really serious that night. They kicked her out because of policy, because she relapsed, and she froze to death with her sweatshirt like that because now there are places that continue to discharge people that are homeless, and they'll say, go sign up to that shelter on blank street. Right. But that person, I don't know how intelligent you have to be to know that they're not going to that shelter because their friend was raped last week.
Right.
And if you don't allow people to be in the hospital long enough so you can hear that, I mean, it's, just getting back to slightly long enough. Absolutely. Because you're getting psychiatric symptoms over real life traumas, not just because you dropped out of the sky and you're psychotic one day. I mean, I'm sure that you were exposed to something.
I think somebody in the literature, and maybe it was in The Body Keeps the Score or one of those things, they talk about the fact that medical providers need to be cognizant of the fact that when they're trying to help, if they're doing something that they wouldn't do to their friend, their family, whatever, perhaps they're actually reenacting some sort of trauma that person hasn't told you that they have, right? You're trying to force feed a patient who stopped eating.
Right.
Well, if you don't actually talk to the person and listen to them and what it is that they've got in their past that might be guiding their future, you're going to miss out on a lot of ways. Like you say, she's not going to that shelter. Her friend might have been raped there last week. And you go, well, that would be good information to go, well, maybe we need to find you a different place. Maybe we need to do this. Maybe we need to, meet you in the middle.
That person.
Right. Yeah.
Possibly. Because you know how many people have that thing called white coat syndrome, whether the doctor, nurse practitioner, PA, whatever, is, even if they're not wearing a lab coat. And, ourselves included, probably from the incubator days, because we actually survived. And it's so funny because the primary care doc that we both had in the end, he knew perfectly well a couple of things, that we weren't going to get some certain blood work. Mm-hmm. Yeah. And he didn't want to waste money, and good for him. And he wanted us to just prove to him that our blood pressure was normal. Both of us had normal blood pressure, but every time he took it, it would be sky high.
Yeah, that's why I have the blood pressure cuff on.
Right, there you go. Yeah. But once somebody else took it, and I vaped a few times in the bathroom and came out, I was totally calm and had a wonderful blood pressure.
Now, we can't endorse this.
No. But what I wanted to say about, in fact, I hate that the information that people do need to hear from patients often comes at the end of the visit, whether it's a medical setting, psych setting, or whatever, because so many people get nervous. They want to make sure they mention everything, and they get very intimidated very quickly, and there was a era in at least the area we grew up where, somebody might say, where'd you get your medical degree? Ugh. Mm-hmm. And once you say that just shuts the person down, in my opinion, like, oh no, now what do I do?
Right. So, and a lot of people do shut down in that situation, particularly because you're talking to somebody who's supposedly an expert. Right. And you go,
right.
And in today's world, we still could have that potential, because now we're lacking information asymmetry. Now we've got information symmetry, perhaps uneducated information symmetry. Right. But I can go on Dr. Google and find out that everything that I have is probably cancer.
Right.
And and be absolutely assured that my symptoms match that and self-diagnose. And so you can go in, and I think some comedians said, why do we have these drug advertisements? Because, like you're going to go into the doctor and he's like, hey, you got any medications you want to try? Like, yeah, how about,
Right.
why don't you give me that? Oh, that's a good idea. I hadn't thought of that. Like the doctor's going to be looking for suggestions for drugs from his patients. But I also read that and I, again, have no idea where, that at one point they analyzed and they found that doctors waited about 20 seconds into the visit before they first interrupted the patient and stopped them.
Wow.
So you go, how are you? You're never going to get the full thing if you're going in there as the expert. And not to derail this conversation, but I had a similar, are you a doctor? Where'd you get your medical degree? Kind of thing happen at the Department of Motor Vehicles when I told the woman behind the counter that she wasn't doing something correctly. And she said, do you work at the DMV, sir? I could, no, but I've read the website and here's the printout. And ultimately the manager had to get involved and it involved 2 more trips. And she was like, oh, actually, no, you were right. Like, yeah, thank you. It's rare that happens, but every once in a while you can.
Yeah.
Now, hopefully we aren't more right than our doctors, but you never know. Because they did go to medical school. I mean, I do place some, value in all that. So, I mean, how we all have trauma, perhaps some of us to a lesser degree, right? Because we haven't directly experienced those things, but we've seen it happen. We're certainly reading the news and watching things happen. And everybody kind of knows somebody, like you say, the 6 degrees of separation kind of thing. It doesn't take very many steps before you're surrounded by or know somebody who has been even more directly affected by it. How do we get past it? What do we need to do? What's the secret?
Unfortunately, we have to be validated, just like the zebra. The zebra was able to go back into the tribe and not be made fun of. The zebra didn't, the other zebras didn't say, did you take your medication today? You're bipolar. Things like that. They didn't push buttons. They coddled it. What they do is they sort of surround that wounded zebra as they're traveling so that the stronger ones are on the outside. So we just have to be a little kinder and we have to validate, say somebody's raped and they come home and the person says you were not, or believes the perpetrator.
Right.
Or I was just thinking about this, the LGBTQ, why are they suiciding? What is going on? They are going to, I guess it's called an unaffirming household. I want to just say a non-friendly
or not validating.
Not validating the lifestyle. The whoever doesn't like the lifestyle. So they already have their hands tied behind their back now.
Yeah.
Now, think of a zebra. You brought it up, and I didn't even think of this when I used to call it that. Thank you. But we were talking about black and white thinking. The zebra's there to remind us that if you don't treat the person like me, you're going to have black and white. And that's what we have, a society of black and white, and you cannot be confirmed.
That was a little bit of Catholic.
That validating that we did in that old building back in the 80s when we were taking people out to eat for pizza. We were validating that now this is a friendly visit. You're not going to get raped. We were showing them that you can live again and not have these things happen to you. And come to find out, that's what's in The Body Keeps the Score, but also veterans right now have jobs where they help other veterans with PTSD. And what do? They take them outdoors to do whatever they want to show that you're now being, affirmed. So what I want to say is if insurance companies would get on board with that, that would be unbelievable. It would be wonderful.
We can have we can talk for hours on the problems with the way that the insurance companies are doing things. And I had this argument recently, and I don't like to have arguments because nobody's ever going to change their mind from directly an argument, but had a spirited conversation with somebody who's like, well, we can't have socialized medicine. Look how it goes in these places. We already have it. That's what insurance is. Like they're spreading the risk out among a bunch of people. And because we're in and I'm not advocating for one thing or another, but we just need to look at what we currently have and go, this is not perfect. And no system is perfect, but maybe we can optimize, maybe we can do it better. But the kind of gatekeeper aspect of my doctor says this is what I need, and the literature says this is what I need, and I think this is what I need. Well, you don't meet the treatment criteria for that, so we're going to deny that, or we've got to wait until you've done this and tried these 3 things, which is going to take a year, right? You have to try the cheaper drug first, and you have to do all these things. But there might be a way to get people on board with, like, this might be unconventional, but if it works, maybe you should cover it. Like, hey, it worked. It did what it was supposed to do.
You know, there's this opioid called tramadol for pain. And right before the opiate crisis was so out of control, I read an article that said they're going to probably approve tramadol, this opiate, for treatment-resistant depression. And one of my clients was lined up. She wanted it. And then, nope, of course, we could not.
Right.
Right.
Well, and there's part of the thing that we get into, and I feel like we have it worse in this country than other places, but everybody wants the latest, greatest, right? I want the best one. I want the new one. Give me the one. And of course, what we have to remember is new in medical terminology also means untested long term. But there's a lot of data about these things, and that you can learn. You go, well, you know what? Let's try it. Just because we don't have efficacy data, or it's new, or it's whatever, doesn't mean we shouldn't try it and gain a better understanding of some of these things. But also pay attention to the data. I do get that some of these new antidepressants are not as effective, or not any more effective than, say, first generation SSRIs and things like that. But whatever it is, you go, well, it might work. It could work. Like that's the thing, right? I mean, you're not going to let me.
It might work a little bit better than the last one,
Right. And when we're dealing with, I talked with a guest a while ago who is actually a hypnotist who specializes in people with alcoholism and those kinds of conditions, addiction disorders. And she said there is an issue that we don't talk about, which is the fact that some of these things are subconscious, and that you can consciously go, I know I shouldn't drink. I don't want to drink. And then be in a situation where you're operating on the programming and those kinds of things. She said, but you've got to remember, AA does not have that high a success rate. It's not particularly effective on a percentage basis, but it's the best thing that we've got that works for the most number of people, even though that's not that many people.
Yeah, right.
So you
and it's sad that it's better statistically, it sounds like, than a 30-day rehab.
Right.
I haven't looked at the latest statistics, but 10 years ago, it was out of 100 people that went to a rehab. 1 year later, only 1 out of 100 was still clean.
Right.
So well, clearly,
and of course the big issue is that you can't just do one thing, right? If you go to a rehab, it's like, okay, I got clean, but never dealt with any of the underlying reasons for why I got, say, dirty in the first place.
Right.
It's out of my system physically, chemically, but not mentally. And just do the same thing. You can't just treat it with the mental side. you got to do both. And probably that's a way to look at almost everything we do in life. Don't just try one thing and expect that one thing is going to solve every problem. That you might need to take a combined approach and get a couple different things going. So you guys have written a book.
We have. We should be done with our second book, but no, yes, we have written the first one, completed it, and it is there. But the second book is we keep a drawer open actually just to show us there's paper and pencils that we haven't worked on it yet.
We worked on it yesterday. Thank you very much.
But the first book is funny. It's ADHD friendly. That's what we wanted, because if you first try to get into therapy or into a self-help book, according to us, well, me, I was intolerable. I was just a hateful, that's it. If there's a God, he or she can forgive you. That's not even my job. Get away from me. I was vicious. My tribe left me. They did not follow me. But Jane, she would try to read them, and I asked what they were like, but I don't know. We threw them away a lot. Anywho, so our book is very funny. And when we were rereading it, anything that wasn't
funny,
easy, we deleted.
Yes.
And the second book is probably going to be a little bit more, it's going to be harder.
No, I think it's going to be,
it's not.
No,
be
it'll
harder.
be simple, but for a lot of people, not easy. And, it goes into this whole, we are all the biggest roadblock to our own problems.
Yeah.
Why is that? Tell me more about that.
I think
that's just human beings.
You know what? I think it's our ego. If you think about it, and AA, it's funny you talked about AA, because every time I hear AA, then I think about the hideous addiction I had of cigarettes, why I started, excuse me, how I couldn't quit. It was horrible. I went to the hypnotist. That's what made me think of it the most. But anyway, can I just finish the cigarette thing? The hypnosis worked. And so I love your guest there, because somehow I got hypnotized. I walked out and I just did not want a cigarette. It's similar to when I took that medicine that I didn't tolerate, Chantix, to quit smoking. I couldn't tolerate it. But you can have an argument. You can have a beautiful dinner with somebody and be triggered subconsciously about something, and some people say this life, some people say it could even go to past lives if you're into that.
Yeah.
And my God, I would walk or drive through danger to get a cigarette, to get that. And I lied right to my son's face. I mean, so the lie, cheating, and stealing is such they're symptoms of addiction. And if we treat it, now we all know how lie, cheat, steal. I don't have a lot of tolerance for that. But if we could train ourselves to have a little bit of a better response, because imagine treating a diabetic who gets symptomatic with a high or a low blood sugar as nastily as we can treat.
Yeah, like crumble cake and throw it at them. And then say, see ya, wouldn't want to be ya.
Well, so you say that, it reminds me of a story. Mary Tyler Moore was a diabetic who was not the. Today we look at a lot of diabetics, and people who become type 2 diabetics are usually overweight and all those kinds of things. And she was none of those things. I mean, she was svelte and lovely and on TV all the time. But she found out that she might be diabetic, and that threw her into such a tizzy that she went and got a dozen donuts and powdered donuts, and drove around Beverly Hills eating them, and then went to the hospital. And I think she set a medical record for having the highest blood sugar.
I never heard that story.
Without being unconscious. I mean, she was like, she might have put herself into a coma with how much she ate. But there is a strong disconnect. I mean, and of course, sugar is as addictive as a lot of other things can be, and I don't think we've really looked into that as much as perhaps we should have. Right. But the fact becomes that we don't treat people with humanity when they have some sort of addiction, whether it's cigarettes, alcohol, whatever. When it really does fall to that level, we treat it as a crisis of willpower. Jane, you just
or a flaw in character.
Yes, a flaw in character.
Right.
And like there might not be something deeper going on. That you go, I don't want to do this. Like, people go, I don't particularly like smoking. It's not, but until I have, need that cigarette or whatever. I've never been a smoker, so I can only talk about this in the abstract. But
don't ever do it.
Well, I think on The Simpsons, they're what are you giving up for Lent? And Bart goes, I quit smoking. And Homer goes, good boy, son. It's the hardest thing you'll ever do. Here's $1. Because, but he didn't. He never started. Like, yes, but he quit. Yeah. So the part of what gets me is, and I think kind of the overall theme here is we need to validate people, understand them, hear them, listen to them, and be present for them, and be just a little bit more compassionate when somebody's struggling with something.
Yes.
And be there. So we're getting kind of to the end. I want to talk about just a few more things and questions I try and ask everybody. What would you say is the most underrated concept right now in mental health that people are kind of overlooking? What do we need more of?
I have a thought here. So
Thank God.
We've turned into a pill nation.
Mm-hmm.
And so everybody wants the quick fix without doing the work. And the work can be very, very difficult. Some people are into therapy. Some people aren't. Some people into the alternative, anything alternative. But in my opinion, we have an opportunity. We have turned, our society is very unforgiving, cold, not compassionate. We're intolerant, whatever words you want to use. If we can't change it to a hint of laughter, and we go so overboard, my PTSD presented so much as depression. And I was just telling Joan, thank God I didn't read that book, Darkness Visible by William Styron, because I have a feeling I would have gone even more deep, too deep,
Even darker.
Right.
And that's what happens sometimes when you stay in the trauma and when you're not validated or not allowed to speak of it with somebody who's even going to sit quietly and not judge you. Where do you go with your thoughts? Dark.
Yeah.
And then the most important thing I think we're overlooking, especially with substance abusers, but when you calculate PTSD, most of us don't tell you how much alcohol we drink. Think with opioids and alcohol, what does the person need to forget? Not only are they feeling shame because they don't even want to tell you, and I used to tell people, you do not have to tell me what it is, but please mull that around because that needs to go. That memory is haunting you. So I think that's really important.
Absolutely. Absolutely. So, I mean, right along with that, what's the most overrated concept? What are people putting too much stock in? I mean, yes, quick fixes, but anything else?
Oh God. All right. I'm going to say it, but I want everyone to know that
To view Jane with compassion.
You mean with compassion, but don't tell me because I've had it.
Oh.
The word anxiety has gotten to the point where, you kind of nailed it, Andrew. Once again. So I'm not sure why you're not in a self-help profession. Well, you are doing this, but also I think you should be a political advisor to whoever is running the country. Just one. I mean, you bring to the table these wonderful questions and wonderful points. But anxiety, so remember, now we all want a pill for it.
Right.
No one's doing the things to help decrease it. And the number one thing to decrease it is be present with someone. Just be present with them. How about another one? Oh, I hate when that happens. Yeah, dude, I got it too. Like, just stop denying that there's a whole group of parents, myself included. I am a parent, so I kind of looked at it a little bit. That if you don't share something, your kid meets you when you've already lived, a third of your life. You've accomplished a lot. You are taller than they are. You have already intimidated your child. Share a little something.
Because we're really tall, 5'9". That baby was real little.
One of my favorite people on Facebook, this guy Noah Ben Shea, that used to write the quotes, if you're old enough, on a Starbucks coffee cup. There were these cute quotes. And I got to hear him speak, and he said, take that, when that little kid comes running in the room, 2 or 3 years old, get down on your back and do that little acrobat thing with them, where you're lifting them up on your shins and that thing, because you're showing them not only are you vulnerable, but you're strong enough to get back up. And look at that little thing called laughter. Every kid is going to giggle with it, and it's just too much fun.
Right.
Yeah.
Good exercise too.
Yeah.
Good exercise too.
Yeah.
Yeah, absolutely. Absolutely. Well, thank you so much for joining me. Folks, you can get more information on the Therapy Twins on their website, therapytwins.com, and follow them on Instagram, Facebook, Twitter, LinkedIn. Their book, Under the Hood, is available on Amazon. Links to the book and all their socials are in the show notes as usual. And until next time, we don't have a problem. We've got an opportunity. Thank you.